Dr. Dury, in one of our meetings, we have weekly meetings, he said, "Bridget, I have a new project for you." And of course that's always very exciting to hear because it means we're doing something brand new. And he started explaining neurovision to me and how it works at the visual cortex and, you know, to improve the vision. And of course I'm sitting there going, okay. Interesting, and very skeptical at the very beginning. You know, we're very used to doing surgery here, so that's really been our base of all the clinical trials that we do is really normally based off of surgery, eye surgery. So for Dr. Dury to tell me that we are going to be involved in a study that we are using a computer-generated program with a series of contrast images and that it improves their vision, I was a little skeptical at first. The first couple of patients that we enrolled into the study were the early presbyopes. So the patients who started to notice that their near vision was going away. It happens to all of us. Whether we like it or not, it's going to happen. When the patient, I remember one of the very first patients, he had changed the font on his computer screen. And he used the computer, you know, all throughout the day at his job. And he changed the font size to larger because he was getting to the point where he could no longer see the words that were on the computer screen. And I would say on average it takes about 10, 11 sessions or so before the patient themselves actually start to notice the effect. We notice the effect earlier with the testing that we perform. But he came back to me about halfway through his sessions and said, "I've changed my computer font back to its original size." And I was just like, okay, this is really cool. It's almost like magic because we're really not doing anything. So the risk is very low, and that's one of the things that I really like about it because there are a lot of people out there that are very worried about having eye surgery. I'm very excited about this, again, because I believe that it opens the door for this group of people who will not ever consider having any type of vision correction surgery. You're not doing anything invasive. You are asking a person to sit in front of a computer screen 2 to 3 times per week in a dark room and make choices. You are literally just changing how the brain functions at the level of vision and what you see. Yes, they said, you know, it was all worth it in the end, you know, for me to be able to change the, you know, font on my computer screen so that I can see things up close and not have to have my reading glasses with me at all times because I can actually function without my reading glasses and, you know, be able to see street signs clearer. Absolutely, it was well worth it.